fluid biomarkers have become a prime concussion research focus. Athletic Therapy Ontario's concussion working group has reviewed ongoing research on key fluid biomarkers, such as glial fibrillary acidic protein and neurofilament light chain, which can indicate neuronal damage and predict long-term outcomes. Can you share your biomarker focus and any that might show hope for guiding return to play decisions, identifying individuals at risk of chronic symptoms or other clinical uses?
Yeah, Dawn, that's a great question, and probably one of the most common ones that come up on podcast discussions. Fluid biomarkers are really one of the most exciting cutting edge areas of the brain injury research. As you mentioned, these proteins, that's what these proteins are, like GFAP or NFL, can be measurable in blood and are kind of a window into what's happening on brain cells. But here's a key point. A lot of the evidence so far on these proteins have come out of research from both moderate and severe head injuries, especially in the cases when there's bleeding in the brain, like something you'd see in a CT scan. Now, concussion, by definition, it does not have that CT positive bleed. Those biomarkers, while potential, aren't as reliable. So some of these markers do rise also after concussion, but not in all concussions. And so it's not perfect yet.
Right.
And the changes are small, and there's really lots of variability. So there's some athletes who have normal contact and maybe injure their muscles or injure their shoulder or injure something, or even train really hard that day, and like an endurance athlete can actually get an elevation in those as well. Or people across the age spectrum will have very different results. Or even within an individual, some young women will have different levels over a month, depending where they are within, if they're already started to have their menstrual cycles. And so that makes it really hard to say this number is yes and this number is no. And so while I'm really excited to see where it leads to, and maybe our job is to say, here's the computer on the back end. So it's not just a simple, yes, you've got a urine infection, yes, you're not, yes, you have this thing or not, or you're strep positive for your throat or not. And those are point of care tests that are really helpful. I think it's most likely some of these are going to need to be more nuanced. Or some of these fluid biomarkers are going to be really helpful for like actually the military. Someone's in a field of combat really far away, and do I need to put them in a helicopter because they may need a CT scan? Oh, no, it's negative. Yeah, they're still hurt, but I don't need to fly them out. Or, oh gosh, yeah, you actually do need to arrange the transport. So I think there's still some roles. Now, the biomarkers still have really important roles because they help us think about the mechanism of injury as well. And that can actually help us maybe advance targets for treatments, targets for some of these other things. So it's possible combinations of biomarkers is also going to be really important. So rather than it's this or this or this, it's here's the panel and let the computer chip in this little test help us personalize that care. So short answer, we're not there yet, but it is exciting. I wish I could say this is the one now silver bullet for all, but we're going to still need a little bit of time.
More research.
A little bit.
All right. So with that kind of follow-up question to it is that research shows that the timing of biomarker measurements, the acute, subacute, or chronic phases, is crucial for the relevance. So can you share Transcendent's evidence-informed perspective on the issues of the timing of the biomarkers?
Yeah, so timing is so important. So I talked about all those factors. I talked about, age and the differences in sex and even that. But then these biomarkers also change even within the time of injury over hours to days to weeks and further. So let's just talk about biomarker. We'll talk about blood because we already started about blood, but I do want to talk about some other biomarkers that are really exciting too. So quickly, first about blood. As I talked about, probably the best role right now for the blood is ruling out that brain bleed, which is different than what athletic therapists are dealing on a sideline. But there may be some stuff in like that next day window, like 18 to 24, 36 hours. Some cutting edge research that's still on the process of needs to be validated, et cetera. And it's not from our group, it's other groups, show that GFAP may be able to separate concussion patients from non-concussions a little bit better. But the data sets, to be honest, most of them are male. And again, the signal really drops off if you don't get that right window. So that's it's really trying to optimize that. Now, over days to weeks, the NFL, the neurofilament light that you talked about, does also increase actually. So rather than starting fast, that one comes up over days. But again, that does have influence by recent training load, other contact, and that menstrual cycle for women is a bigger contributor even in that. So it's unfortunately not yet ready to be used for diagnosis or even necessarily guideline, oh, you're clear now, because there's different things that's the other role of biomarkers. We talk a lot about diagnosis or prognosis. There may be roles differently for clearance. But again, it's how high does it go up, but also how quickly does it go down. So I think we also talk about biomarkers. There's also salivary biomarkers. So salivary spit, and the nice thing about that is it doesn't hurt to collect it. One of the things we're doing, and we're so thrilled as one of the members of our team is Steve Hicks. He's at Penn State. He's a scientist who's one of the leading people looking at what's called microRNA. These are really small molecules that are tiny pieces of genetic material. They kind of act like a dimmer switch in the body. So they don't make proteins, they help tell the genes to go higher or lower, if that makes sense, in response to stress or injury. So we can see after head injuries and concussions, those microRNAs in saliva can actually be a window of what's happening in the brain as well. So that actually is very good for athletes, potentially at the sideline, or for kids who are afraid of needles. They're easy to collect. They can repeat over time without having to get poked numerous times. So we're actually looking at that. We're hoping to answer some questions with the saliva. Can they help us improve the diagnosis? Can they better help predict who needs specialized care? And maybe possibly can they have a role in determine who's healed? Because not always healed is symptom-free. Sometimes people with a lot of pre-existing migraines may still be having headache, but maybe they are healed. Or there's also people that they are just so enthusiastic to get back to that sport. And they are telling you, I'm fine, I'm fine, I'm fine. Yet, maybe this is a proof, no, you're not. So those are things that are still not ready. And currently it needs to be collected and shipped and spun and, very expensive test in a giant lab. If we find the signal, we can then move to getting it ready for the bedside or potentially even the field side or
more accessible use for sure.
at that point. So if you were to ask me right now, what's the most shovel ready biomarker? It's not blood, it's not saliva, it's our physiology. And we often forget to think there's biomarkers that do not rely on you or me telling the truth or not telling the truth or over or under emphasizing our symptoms. And those are things that can look at how our autonomic system's working. Those are the things that regulate our heart rate, our blood pressure, our pupils, even our eye movements. And those things can't be faked. You can't make your pupils go big or go small, faster or slower. You can't necessarily change some of those things. So I think there's a lot of promise to looking at these physiological biomarkers.